A lot of my patients ask if they can have a facial or a massage or go for their spa treatment following their Botox or dermal filler treatment. This is a great question, and I always say that treatments with Botox and dermal fillers is safe, effective. My patient satisfaction is always really, really high with it. However, there are certain precautions and certain side effects that you do need to be aware of. When you have your Botox treatment, your practitioner would have done a thorough consultation so they know exactly what areas need to be addressed, and they can target specific muscles which need to be addressed to give your desired result. When Botox is injected, it's targeted to these specific muscles. If you go to a practitioner who perhaps isn't doing a consultation, who perhaps isn't showing you exactly what result to expect, who perhaps isn't diluting the product, because when Botox is delivered to us, when it's prescribed for you, it comes in a little vial, and we actually have to dilute it to make sure that it's the right concentration for you. If this is over diluted, then yes, certain side effects like spread of the filler may occur. However, changes in your head position, changes when you fly, changes in cabin pressure, that's not really going to make much of a difference in terms of spreading the Botox. Something you do need to be aware of, however, is that we always ask patients not to manipulate or pop any pressure onto the areas which have been injected. And this is because we don't want the filler to spread to an adjacent muscle. Now, typically, when Botox is injected, it takes roughly 5 to 10 minutes for the muscles and the nerves to take up that product. So migration of the Botox is very, very rare, and there's been no clinical studies to suggest that any kind of manipulation will cause the Botox to move. However, there have been reports where unwanted pressure to the area has caused a slight unwanted effect from the Botox. Whether that's to do with the dilution, whether that's to do with the targeted muscle or the wrong muscle being injected, it's sort of up in the air, but it's just something to be aware of. So if you are planning a facial or any treatments which involve the face, like any derma rollers, laser treatments, semi-permanent makeup, then just be aware that we don't want to put unwanted pressure on the areas which have been injected. And that being said, we also, you may get a bruise or you may get a bit of swelling around the area. So we want to wait until the skin's healed fully before exposing it to any other treatments. And the same can be said for fillers as well. It does take a bit of time for the skin to heal after you've had filler treatment. The fillers can take anywhere between 1 to 2 weeks, sometimes a bit longer, for everything to settle down. So we don't want to exacerbate any swelling or any bruising. And also with fillers, you do want to be aware that unwanted pressure, especially sort of heavy pressure in the area, may cause migration or movement of that filler. So it's something to be aware of before planning a spa day or booking yourself in for a facial or a massage. So just be aware of that. I always ask my patients if they are planning any type of facial or if they're having, an electrical facial, then make sure the skin is healed fully before engaging in any kind of activity which is going to cause any unwanted pressure in the area.